Hello to my movement professional friends from all over the world. This is your host, Maiko Morotani at Nexus Motion. Hopefully you were able to watch that free webinar about the history of physical therapy and where we're headed into the future from the previous playlist. If you haven't, it's a series of must-see videos because you really get to walk alongside Dr. Shirley Sahrmann in her 62 years of journey as a physical therapist. And even if you're not a PT, there's a lot to be learned. Now, she was so generous with her time that I gathered the most frequently asked questions from over 300 participants that came to the webinar. Now, in order to save time during this webinar, you will hear the question in English and see the question on the screen in Japanese. So please enjoy this Q&A session with Dr. Shirley Sahrmann. This up. Okay, Shirley. So we're gonna go right into the Q&A. All right. So we touched on this a little bit, Shirley, but can you read this? I'm just kidding.
I can really.
So what a lot of people have asked is, the origin story of movement system impairment, which you've touched on, but how did you choose all of those standardized tests that is included in the MSI exam, and how you ordered, because there's a specific order that we go. It's very systematic.
Yes.
So how did MSI come about, and how did you choose all of those standardized tests in that kind of order?
Basically, they were the same movements that I used to use with the neurological patients, in particularly the quadruped exercise, but it was much trial and error. We started, there was probably even more examination items, and they kept showing up that how the back was moving when it wasn't supposed to be moving. It kept showing me how moving the hips was playing a role in affecting the back, and then I learned more about how the hips should move. So they were the pieces of information that were necessary to look at particularly how it affected the back.
There she is.
Yes, there's my dog. Louise.
サーマン先生の犬が見えてますね。
The other thing I want to stress is that when the more motions that we perform and see the back moves, the more clues I have to what it's going to do during everyday activities. So the more movements, the worse the condition. But they also would tell me very much how the person was moving during their daily activities. That's what was important.
Okay. Yeah. It's a long history in how model was born.
I was aided and abetted because all of my colleagues became experts in a specific joint. And so we would work over all of our findings and our understanding of that particular body region and work things out. We spend a lot more time on observations. Now they're down to basically a few when you do those. I need to know how much the hip flexes. I need to know how much moving the extremity twists the lumbopelvic area. So we've got it down to the important observations. And I think the most important thing we've learned is that it's not the exercises that really make the difference. It's teaching people to correct their everyday activities, which you can really look at as performing a lot of exercise all day long when you do that.
Yeah. Okay. What are the important qualities as a physical therapist?
Well, I think the important qualities of a physical therapist is always trying to understand what you see before you and what you do. I've never been one that it could just do something without understanding why I was doing it or looking at the result. In fact, it's where I am in my life now is I may see people as a consult, but that's not very satisfying because I don't know what the outcome is. And so it's carefully looking at what happens based on what you've asked them to do and trying to understand from your knowledge of anatomy, kinesiology, and biomechanics And I have a big advantage of having spent a lot of years in the nervous system. So I kind of know how important it is with motor learning and training that plays such a big role. Let me give you a very concrete example.
Yeah.
That's still important in the examination. When I was young in PT and someone was prone and I flexed their knee and their pelvis tilted, I was told that was because the rectus femoris was short.
Mm-hmm.
Now, it's easy to assume that, but then when I held the pelvis still so it didn't tilt, they had full range of motion from their rectus femoris, so something didn't compute. Now, it took me years to figure out why that was, but it was not accepting that explanation because it didn't make sense when I assessed it carefully.
Mm-hmm. That's a good example. Yeah.
It turned out to be a really big example.
Yeah. Okay. Now we've got a lot of students listening in, Shirley. So as a current PT student, what's the most important thing to learn or to do in school while, they're still young?
Learn everything you possibly can. And I hate to admit it, but it wasn't until I was in graduate school that I really learned how to learn rather than just memorize. And things went in easily, but I didn't really have them fully processed into a learning thing. So I think it's the advantage of physical therapy school is you're applying things almost right away. So it's getting that knowledge in and thinking about how it works in the real world. Not just that you can say, I know where the biceps is and it flexes the elbow, but looking at how it functions in different ways and in a different, for example, we know the quadriceps extends the knee, but you can use the hamstrings to extend the knee because once the foot's fixed and you extend. So it's really understanding rather than just memorizing the information and then trying to apply it. I was always observing how people walked. Even though we learned normal gait, then why didn't everybody walk the same? That didn't make sense to me. Why did some people have so many callous moves? I'll carry on. Okay.
Thank you. Okay, very good. This one here, okay. I don't want it to disappear. Okay. How do you try to best communicate and interact with your patients?
I think number one is that you have to come across as confident, that you know what you're doing, because many people, whether they have pain or they're just paralyzed, are very anxious and upset about their condition. And they don't want somebody that's going to inflict more pain on them, or they don't want to fall. It was hard being a relatively small woman when I had great big men that were paralyzed. They're always afraid I was going to drop them or I didn't understand. And so I think learning to be confident. I also keep monitoring the patient all the time that I'm talking to them. How do they respond to my questions? When you work with enough people, you get an idea about personalities. Do they want to know what's going on, or don't tell me about it, just do it? Do they scare easy, or do they not tell you what's going on? So it's trying to understand the patient, and by watching them, and I want to reassure them that I'm on their side. I'm there to help them. I know what I'm doing, and they can have confidence in me. And then I even did little things all the time. I would always put on my patient's shoes. And the reason why I did that is because I wanted to get down below their level and look up to them rather than they're always looking up to me. I wanted to do a menial task so that they know I would go to any length to help them. And often I just didn't want them to hurt themselves again by trying to put on their shoes.
Right. All right. Anything else that you wanted to add? I cut you off, sorry.
No, it's fine.
No. Okay, very good. Okay. Can you share a story of a patient case that you most struggled with? A challenging case. We just want to hear your clinical stories too. Your stories are always fun.
No. Well, um, one case that stayed with me, I mean, obviously the neurological problems were manifold. I mean, the patients with neurological, and that was such a struggle that it just went on and ended up in graduate school. But a specific patient was a woman that I won't forget, that one of the leading neurologists called me and asked me uh, if I was any good at back pain or something. And he had a woman that he wasn't sure whether she really had a problem or she didn't have a problem. And he wanted me to work that out. And she really did have a problem. And but the case turned out to be quite complicated. I can't go through all of the things with it. She actually had a part of her back that seemed to be sort of fused genetically.
Okay.
And I would have ways that I thought I had her moving along very well, and then she would come back and she wasn't moving along very well. Part of it, I discovered that I think at home, her husband was telling her to do other things. So I think there was a bit of a conflict, and he couldn't follow my directions, but I also learned a lot from her because of the kind of complicated picture she presented.
Okay.
I might add, because this is what also keeps my passion for diagnosis up, is that there were many physicians who would send patients to me for a diagnosis. One of the neurologists said that she needed me and the radiology department to be able to practice. And so that it's not clear, particularly with old people, when you do an MRI, all body parts are degenerated, where the pain's coming from. And I think that if there was more respect for our diagnostic skills, in fact, many physicians would have to tell their patients that I wasn't a regular physical therapist because they had been to physical therapy already. So that's why I think the labels are important in figuring out what's going on. This woman, it was a problem between her back and her hip, and I wasn't sure which was the most causative factor. It turned out to be an interactive one. And then I always like telling the story about my 82-year-old uncle with pain in his knee, and he got a new knee, but 6 months later, he still had the same pain in his knee, and it turned out to be spinal stenosis, which I could help him with in 45 minutes.
I know we kind of talked a lot about the future, but what would you know, any other things you hope for the future of physical therapy, and what must be really do? And if you could also touch on maybe like how you want the education to evolve in Japan currently. You know, they're at a bachelor's level, but what you hope for the future PT, what should we do? And how can the education evolve?
Well, you know, I think, and that was the whole point of this story, is that conditions now are ones that start early, and there are movement related conditions, and that we need to, one, say that there's such a thing as a movement system, and we need to demonstrate our expertise in that. You can take the same courses in anatomy, physiology, and you just know that what your responsibility is for how these work together with an emphasis on movement. And that we want to be movement experts, not reliever of symptoms, but really being able to analyze movement and see how it should be optimal. And the tricky part is identifying structural problems from acquired problems. You're not going to make everybody perfect, but you need to know what their constraints are. You know, and it's also the change from not just seeing persons to relieve pain because there's a specific problem at this time, but I think people should have yearly exams. I think they should be able to come in if they've got a complaint or they change their activity, so that we're really taking on the responsibility for how this movement system grows and is used, and and develops. And then if there's a problem, being able to figure out what the problem is. That's a lot different than just saying, I'm going to take care of your knee because you now have a new knee. You know, I'm going to give you these exercises and then it's over with. And
go ahead.
let me just make, there's a real interesting piece of, well, go ahead, do that first, and I'll tell you. I was going to tell you that there's a very interesting study that was just published from WashU. It got a lot of press, where these physicians put their arm in a cast for, I think it was several weeks, and they did MRIs every night before and after. And it turns out that when the arm was in a cast, the brain disengaged itself from that arm. It didn't talk to the rest of the brain. It kept activity. And it's a point that I think is important, because it says when people have a problem, they don't just automatically go back and use it correctly again. They've got to be retrained, partly because they probably weren't doing it right in the first place. And then you've got to learn not to limp. You've got to learn how to move correctly again. So it's not just an instant visit. It's something that's got to be followed over time.
That's fascinating study.
It's fascinating.
Yeah. Okay. Now this one here. Okay. With the COVID pandemic, how do you think physical therapists should evolve? And do you have any suggestions on how to best utilize telehealth physical therapy?
In some ways, I'm kind of excited about the opportunities that this has provided for physical therapy, because with telehealth, what you have to do is be able to observe how people move. The only way you can treat them, if you're not going to just talk to them, is to see what they're doing, how it causes pain, how they can do it safely. If they have a neurological disorder, what can you recommend to them for safety or performance in their thing? So this is, to me, a maximum opportunity for physical therapists to demonstrate what their expertise is and how they can intervene. Now, I understand there's going to be a lot of work done with these people after they recover as well, when we can see them again. But I think this is, and I think it also provides an opportunity for follow-up that might not be there if people have to come in on a regular basis and they can just have a telehealth session. And then you can see in their homes how they're performing, which is a lot different than in a clinic where everything's all set up for them. So there's a lot of advantages of these opportunities in telehealth. And I think that actually this is going to be such a big part of practice that there's going to need components that are introduced in the educational programs on using telehealth from the standpoint of the technology, some kind of understanding, as well as the specifics of the delivering the services. There's work to be done to get it sorted out.
As so many people ask this, as artificial intelligence spreads in our society, how should we adapt, against these like new technology?
Oh gosh, I wish I had an answer to that. I think that and big data are everything. When you get as old as I am, everything has pros and cons, and I think that technology is a wonderful thing, because it even allowing, I have like 3 watches on. Always, you're this old, you got to have something tell you you're moving. But we can track how many steps people take. They can hold things and see if they oscillate. That there's a lot of ways we can use intelligence, the technology to give us information. And I think it's the same thing about artificial intelligence. It is artificial. You need human judgment to set these things up, but it provides a way of getting data that we can see. It should help us sort through the effectiveness of our treatment if we reduce the variability. I don't have a specific answer, but I think it's all there that we have to think about how to use best to meet our needs.
Yeah, it's a tough question. All right. So this one here, what is your secret to having passion, so much passion for physical therapy after all these years?
I was hoping you would ask me that because it really boils down to, I know how much we could do for people's health. I mean, exercise and activity is critical for every condition, as I mentioned. You can't exercise if you're hurt. And if we can optimize how people can stay active, how they can keep themselves, we'll reduce healthcare costs, we'll reduce suffering. And I know now that I'm not just a cheerleader encouraging people to go out and do it. I'm the one that can also facilitate how long they can do it and how well they can do it. So it's kind of like a true conversion from a big responsibility now as compared to not that much responsibility, just being a cheerleader. So it's easy to be enthusiastic. I know how much there is ahead for us. One more comment is yeah, I've had the opportunity to see much of the world, and I know that physical therapists or physiotherapists around the world are very committed, very smart, very wonderful people. And I can't think of a better group to take on such responsibilities, to make such contributions.
How do you keep so energetic? There's a bunch of there's young ones here, and then there's some elderly, experienced therapists here. They'd like to get some advice from you for longevity.
Well, I'm a big believer that if you don't use it, you lose it. And I scare easily. So I've just been fortunate enough to be in a profession that kept me active, and that where I've seen the benefits of exercise and activity. So I get in my little exercises to stay aligned, and I do my little semi-aerobic things. I walk 5 to 6 miles a day, ride a stationary bike periodically, and try to eat as healthily as I can. So, and then I'm driven by the passion of my profession. Besides, I need to talk to the Japanese about longevity, not to me.
So many centenarians in Japan. My grandma was 103 when she passed away. So, yeah.
You know, I also have to add with this virus thing, I thought I was in Japan all the time because everybody was wearing a face mask.
Okay.
Never looked so good.
私はマスクしてる方がね、美人に映るんですよねって言ってますね。
I'm saving on lipstick.
All right. If you had 50 more years to live, and I certainly hope you do, what would you like to accomplish?
I would just really I'd like to see the recognition of the movement system. I'd like to see that people ask physical therapists to see patients to get a diagnosis. I'd like the public to be coming in to get a diagnosis of their movement system. I'd like to see that people are getting yearly exams, like we go to the dentist for our teeth. They barely show. We only use them for 2 things. And we got our whole body that we need for everything. And I'd like to see recognition that it takes management. You can't just wait until it falls apart. So 50 years sounds like a long time away, but it's been 30 years that I've been trying to promote the idea of a movement system. So things seem to take a long time, but these days I don't think we have a long time if we're going to get the professional recognition we need.
Okay, we got a last question here. Aside from studying through the MSI textbooks, what's a good way to continue studying the movement system impairment?
Well, I think the people of Japan are very fortunate because Maiko is providing all kinds of opportunities for you to learn more by continuing education courses and preparing various kinds of virtual courses for you all. And I think that trying to get as much information as you possibly can, applying your anatomy and kinesiology, if you get the principles down, you get the gist of it, then you can keep teaching yourself. It's that idea of you don't give somebody a fish to eat, you teach them how to fish. And that's the purpose of the courses, is learning how and then building your own expertise there. But you've got a great resource in Maiko. And I just, and all the wonderful work she's doing, I can't praise her enough. I
Thank you.
mean, it's really true.
Wow. Sorry, Shirley, we went quite a bit over time, you know.
Well, I see many people hung in there with us, so I thank you all for giving me the opportunity to discuss this material with you, and wish you all the very best for the future. I know it'll be wonderful.
Thank you so much for your generosity and your valuable time. To, I think all of your important messages were recorded and all of your jokes are recorded, and so they can go back to it as many times as they want to and take notes. I hope that when it is safe to fly and travel, that we can see many of the people here live in Japan.
Very good.
Yep. All
Thank you.
right. Well, thanks so much, Shirley.
Bye now. My pleasure.
Bye
Thank
bye.
you. Bye.